Welcome back to Ask Dr. Mingle. It's great to see you again. I am Dr. Dan Mingle, family physician, founder, and CEO of Mingle Health. I'm here to answer your questions about value-based care and value-based payment. Let's dig in. Today's topic is the 2026 final rule for the physician fee schedule, which includes all of the elements of the quality payment program, including MIPS Value Pathways, alternative payment models, and the Medicare Shared Savings Program. This episode is about MIPS Value Pathways. I divided my comments on the final rule into 6 topics to keep them short and focused. This is on the MIPS Value Pathways, or MVPs, what's new for the 2026 performance year. If you want more reading material, if you want to dig in more deeply on MIPS Value Pathways, I recommend this document available from Medicare. It's a 71-page slide deck that goes into a list of all of the quality measures, cost measures, improvement activities, and the rules around using each MVP. You can get it in this next slide at qpp.cms.gov. Great website, lots of good materials here, created by Medicare. In the banner is a link to resources. If you click on that link, you'll get to the resource library. Look at that second topic under the resource library, regulatory resources. This document, that MVP inventory, is indicated in red at the bottom. So pull that up if you have more interest in the MVPs. One of the most important new rules for 2026 involves mandatory subgroups. Up until now, any group, any individual has been able to do an MVP. The whole group get credit for a single MVP. Now that has changed, and Medicare has initiated a year later than they initially planned to that mandatory subgroups. Now that only affects large multi-specialty groups. By large, I mean groups of 15 or more providers that are more than one specialty. Those groups are required to break into specialty-specific subgroups, or more accurate to say, measure-specific subgroups to do an MVP. Now, Medicare is having difficulty assessing specialty, and they've decided to stop assessing specialty for MVPs in specific. So at the time you register for an MVP, registration is due between April 1st and December 1st of each performance year. When you register for an MVP, you will attest to your multi or single specialty status and what specialty you're declaring that to be. Medicare is defining a single specialty as a practice where all clinicians are in one specialty, or even if they're in different specialties, they're all involved in a single focus of care. That would be when you have a team providing cardiovascular care, or a team providing respiratory care, COPD, or rehab services, anything like this. So when there's one clinical focus, you can consider yourself to be a single specialty group. So with this change in mandatory subgroup requirements, they're redefining the term MVP participants. It can be, as it's always been, an individual MIPS eligible clinician. Any individual can choose to do an MVP. A single specialty group can choose whatever MVP they feel is appropriate to them. A multi-specialty group that meets the requirements of a small practice. So if there's 15 or fewer providers in a group, they can choose a single MVP to report as a group. Any registered subgroup of a practice can report the MVP they feel is appropriate, and any APM entity can report MVPs. And again, register for MVPs for the performance year that you want to report. In that performance year, between April 1st and December 1st, you need to register. And when you register, you'll declare whether you are a single or multi-specialty group, and define your subgroup or subgroups as you choose your MVP. Now, we're still moving towards sunset of traditional MIPS, although a date has not yet been set. The last time they estimated, Medicare suggested 2029, maybe when they sunset traditional MIPS and go to all MVPs. Now, there are 6 new MVPs coming live in the 2026 performance year for diagnostic radiology, interventional radiology, neuropsychology, pathology, podiatry, and vascular surgery. Again, the details of what measures go with that, what quality measures, what cost measures, what practice improvement activities go with that. Details can be found in that document I directed you to earlier. On the right in this table, I've listed the associated cost measures. Possibly the most defining point of an MVP are the cost measures that track with them. And for these others, there are now 27 MVPs for the 2026 year. They're listed here, including the 6 new ones. Again, that document I directed you two in the earliest part of this presentation has all the measures and cost measures defining each of these MVPs. Now, for the 2026 year, you'll notice that MVP specifications have been reformatted. Now, there have been some changes in specifications, some sorting of measures, but one of the most noticeable changes is that reformatting. Medicare has the cost and quality measures into clinical subjects or clinical topics, so they can help guide you in whatever the particular scope of practice defines your practice. You can be guided to those measures that are most appropriate for you. Now, this has nothing to do with what your choice is, or that you don't have to do all the measures if there aren't 4 measures in that clinical subject stratum. It's simply a convenience to have it listed that way. You're still required to choose 4 measures. You'll be scored on whatever cost measures are in that MVP for which you have at least 20 eligible patients. Now, CAPS for MIPS, that is the survey measure, is an option for many of the measures, not all, but certainly many. It's listed in the measure inventory for each MVP for which it's applicable. There have been some changes in CAPS for the 2026 performance year. They've added a web-based survey mode that will start in the 2027 year with a protocol of administer the web survey for those patients who don't respond to the web, contact by mail. For those who don't respond by mail, contact by phone. And survey vendors must now offer a Spanish language translation for your Spanish language speakers in your practice. Now, if you're going to use CAPS, there's a separate registration process for the survey measure. You need to register for the survey measure by June 30th. You don't have that till that December 1st date to register for CAPS. It has to be done by June the 30th. Third-party vendors have a role in MVPs, that is, particularly qualified registries and qualified clinical data registries. Those are now required by Medicare to support the MVPs that are applicable to their clientele. They must be able to support those MVPs by 1 year after the MVP release. Now, you can count on Mingle to be supporting all of those MVPs the year they're introduced. So we'll be happy to help you with those. Now, there's some strategic implications for MVPs. A couple things I recommend you keep in mind. Perhaps the most important for MVPs, it limits your exposure to cost measures. In traditional MIPS, you will be scored on any cost measure for which you have the 20 or more patient denominator limit. When you choose an MVP, you limit yourself to just the cost measures that are in the MVP. I suggest you try one or more MVPs in your group practice. We're going to be going to this full time in the next decade sometime, and perhaps much sooner than that. Um, you can do it relatively risk-free if you're making at least one MVP submission in your multi-specialty group practice. You can also make a traditional MIPS submission to cover the rest of the group, and your MVP submitters will get the better of the two scores: the MVP that applies to them, or the traditional MIPS, the group traditional MIPS submission. So it can keep that relatively low risk to start practicing and understanding the MVP process. And that really wraps up this presentation on the MVP. Thanks for joining me. I look forward to seeing you again for the next presentation. Please ask your questions. If I can make anything clearer in this topic, ask. Correct my answers if I've made any mistakes. Contribute your experience and comments to just clarify those things that I've said. We are smarter together. Thanks and good day.